Thank you so much, Dr. Darren Schulte, for joining me today. How are you?
I'm doing well, and you?
I'm doing great. I'm hoping today we can talk a little bit more about how AI is being used during this COVID-19 pandemic. So, can you start off by just letting us know how exactly AI is being leveraged to improve processes during COVID-19?
I think it's probably in two ways. I think the first is to try to get a handle, and certain countries have tried this on the spread of COVID-19. So, trying to determine based on testing which positive patients have interacted with other individuals that then would need to quarantine or take additional self-isolation measures. And certain countries have done so, a lot less so in the United States, given the relative unavailability of testing and testing kits. I think the second main way in which I've seen it being used is to determine characteristics of individuals who are COVID positive, especially those who end up being more severe in terms of their illness. And based on those characteristics, can we get ahead of those who might fall into those high risk categories for additional quarantine or social distancing? However, that said, most of the country, this United States and a lot of other countries have already gone into shelter in place. And so we're already doing quite a lot to keep people from interacting with others, with the exception of doing things like trying to get groceries and the like. But for those in the highest risk categories, even that going to get groceries or other essential items should be something that they have others help them with. And so by getting characteristics of those at the highest risk, in addition to just those who are older among us, I think is how AI and leveraging that across medical records can be useful today.
Are we seeing that AI is being used more in particular areas of the country or in particular medical centers? Are there any trends that you're seeing there?
Hard to tell. I think medical centers are probably more faced with real issues of protective personal equipment shortages. How do I get a ventilators? How do I set up intensive care units? How do I set up hospitals in terms of additional beds? So they're kind of more on the front lines of immediate care. I think what I'm talking about is more public health measures that are being taken into account by public health departments, researchers, health systems that aren't, part of them not thinking about the frontline issues of caring for patients who present to hospital.
So, what would be the best way then to use AI and technology during this time?
I think that at this point, like I've mentioned, taking into account those characteristics of people who are gonna suffer more from COVID, we're starting to learn that your body's immune reaction to the disease is potentially what's causing some folks to have particularly worse outcomes. But we'll learn that through determining from thousands of medical records and lots of data how that's in fact the case. And as I mentioned, also trying to determine spread, communicability, transmissibility, from smartphone data and other data. What other countries are using that, probably in this country, I'm sure privacy concerns, would be invoked. But I think that's where we could see it. I think you're going to see a lot of things after this pandemic that we'll learn to prevent more of this in the future. More intensive testing, determination of who's being, how the spread is evolving across this community. So for now, I think we're learning how AI could be useful, and probably more so for the next pandemic than this one, given that it's well spread across most countries of the world, unfortunately.
Is there a particular level of training and understanding that physicians need to have to use AI?
I think if built correctly, no. I think except for the sort of the data scientists who are considering how best to use the techniques. But if done well, it should be something that should inform with insights physicians, public health officials, those that are helping to advise cities and localities how to react to a particular infection, what's the best social distancing required, how do we balance between way of life versus isolation. Hopefully it doesn't take a PhD to understand it. It might take certainly PhDs to create the algorithms that derive insights. One other key area that AI can be helpful with is rapid discovery of drugs that can be useful in treating the disease and looking at the drugs being used in individuals, its properties, and how one can use that to fight the infection. Secondly, go through particular ways in which vaccines can be developed. I think AI techniques can be leveraged to create the types of vaccines that could be most effective, because you want to get a particular candidate in testing as quick as possible so that we have a chance to develop a vaccine within a reasonable period of time. And I think new machine learning and AI techniques can be used to create vaccine candidates, as well as determining particular drugs that can be used to fight the infection in individuals with COVID, for example.
Right, and then that would obviously speed up the whole testing and diagnosis process.
Correct. So definitely treatment. So on the one hand, there's how can we limit spread? How can we test effectively? How do we determine that who should be quarantined? And then when you're ill, what drugs are effective? And ultimately, how do we get a vaccine into the marketplace so that we can effectively create the immunity we need across the population? And that's the best way and the ultimate way to solve this pandemic.
Now, along with AI helping with drug discovery, it's also kind of helping with the rapid dissemination of information. Can you dig a little deeper into that?
Yeah, I mean, so when you mean rapid dissemination, I think that we're talking about how to get in place trials like the one that the World Health Organization is doing to try to assess 4 different types of drugs versus usual standard of care and determine rapidly across dozens of countries what works and what doesn't. Data and data insights can be then analyzed, and relatively quickly we get to answers as to what works and what doesn't. Certainly drugs like the anti-malarial drugs that people have discussed are chloroquine are being considered. HIV drugs, anti-TB drugs are among the candidates. So it's important to try to get those studies done in an effective way, in a way in which it's going to determine truly if the treatments are effective.
Now, taking a step back, you've mentioned a lot about electronic health records and data. How does a lack of interoperability play a role in this pandemic?
It's actually one of our Achilles heel in a public health respect, which is to say, if we had a pool of information that is continually being fed from individuals in terms of their health records, that then we can use in a secure and de-identified manner, we can get a handle on more quickly those who have worse outcomes and why, which drugs are effective and why, what characteristics are among those that tend to recover fast. If we had one pool of information, digital information to analyze, we'd be much better shape than we are now, where every hospital's got their own data set, every public health department's relying on only self-reported information for the most part. We are really seeing the negative effects of a lack of interoperability between electronic health record systems, which is truly a shame in the time in which we really need it the most, and the time in which we can really use AI to rapidly determine with the digital data the answers to the questions that we have.
Is it possible that this then is leading to worse outcomes for patients?
It might, or at least it leads to a lack of understanding of drugs that can help future patients, right? Those that will present to hospital and we have more effective treatments and we have data on it, we'd be more comfortable in telling physicians what to do, how to do it, and disseminate guidelines of care that can help now as opposed to months later when the dust settles and then we have a handle on what works and what doesn't, but by then we've already run its course.
Are there government organizations working right now to try to improve these processes and make interoperability a little bit easier? I know CMS came out with their rules a couple of months ago. Is that in any way helping, or it's still way too early in the process for us to see those benefits?
Well, so far, and I'm really excited to see that the Office of the National Coordinator of Health Information Technology, ONC, recently published rules that relate to the Cures Act, which was passed several years ago. These rules relate to in creating more interoperability between record systems, blocking what we see as a lack of information sharing. They call it information blocking, prohibiting that activity, and mandating electronic record systems set up and providers use APIs, which are ways that electronic systems speak to one another, right? Set up these APIs based on or standards accepted at the national level, and that this would allow for data sharing that would be seamless, certainly a lot easier to use, and patients can get access to the data as easily as sometimes health insurance plans are able to, or other hospitals can, although still today with a lot of effort. So I'm excited to see that. It's going to take 12, 24, 36 months. It's going to cost money. But at least we have focus from the national level. Congress is behind it. Health and Human Services are behind it. And I believe that post-COVID, we'll have even more incentives to do this, given the types of things we've discussed and the types of benefits we would get from a common data pool and the ability to analyze it and derive benefit from it.
Now, along with a lack of interoperability, you also can kind of see patients who have comorbidities or who are at a higher risk. How can AI be used there, at least, to help flag down those patients who might need extra attention?
Well, so if we know that certain characteristics like age, comorbidities, autoimmune disorders are associated with worse outcomes, we could be more aggressive in treating those patients earlier in their course of their disease. So we take action sooner when there's early indication of symptoms of the disease, then certainly with insights, we can then take action to avoid worse outcomes. Today, unfortunately, we're trying different things, but for the most part, we are doing the best to provide supportive care measures, maybe some drugs being tried, but in some cases, unfortunately, it's too late by the time you're in the intensive care unit or on a ventilator, which hasn't shown for the majority of individuals to be effective once you're that advanced in your illness.
Are there any other challenges that are present that AI might be able to help fix, whether it's administrative reasons or anything else?
I mean, I think it's surveillance of populations early on, so that when we see that there are new and novel viruses and outbreaks, that we determine the communicability, how fast does it spread, what in the public has been described by epidemiologists as R naught, which is if I'm infected, how many other people that I'm around get infected, knowing that early, understanding therefore how aggressive to do testing, isolation as a result of coming in contact with those positive. That data, the sooner we get it, will inform public health departments to take action sooner. We've seen in the Bay Area, San Francisco Bay Area, that shelter in place, I think we've done this earlier than any other municipality in the United States, has, I believe, caused us to begin to truly flatten our exposure curve. That was aggressive stance taken early. With data, though, we don't have to have guesswork. We can have a natural response based on information that can help us make better decisions.
Do you have anything else that you would like to add about how AI can be used during this time?
I don't, but I would say that the most important thing is availability of data. So if we can all understand that it's not enough to have data that's electronic rather than handwritten data, the way when I trained, we used to record information about care. It's not enough if you don't have it, digital data widely accessible in a secure manner, but that becomes really critical for public health. So in public health for the 21st century is based on data and data insights. without which we are just guessing on what works and what doesn't, which is unfortunate with a rapidly spreading virus like the one we're unfortunately having to deal with today.
Thank you so much for joining me today.
Thank you. Appreciate it. Have a great day.